Obviously, minors still have to have their parents' consent for any service like a vaccination.
Dave Kimball, Healthcare Chief Executive Officer, says there are a few things to consider with the new changes. He says teens 16 and 17 years old are limited to the Pfizer vaccine right now. Today, local hospitals react to the governor's pandemic address. Governor Lamont announcing Thursday that the state plans to accelerate its vaccine program even more. Everyone 16 and over are now eligible to schedule a vaccination appointment beginning April 1st.
We're finding we had a fair number of doses available on our appointment schedule, as days went on.
The governor giving an update on cases across the state.
Our infections are no longer going down. They plateaued, in fact, creeping up a little bit. We're not out of this yet.
Hartford Healthcare Chief Clinical Officer says they are seeing what's happening across the state.
We are finding the number of individuals who are getting admitted to our hospitals right now are younger in age group.
Teens might soon be considering spring break.
Do you have a concern for them doing that once they're fully vaccinated?
Well, I think they are safer than the population that hasn't been vaccinated. But I do think it's so important to continue to social distance and also to wear their masks.
The CDC also announcing the importance of vaccinating the most medically vulnerable communities.
They are recommending that dialysis providers start to offer vaccination to their population of patients because of how sick they can get.
Do you find that to be true with your patients?
Yeah, absolutely. We know that being on dialysis in its own right is a risk for developing more severe COVID. However, many of our dialysis patients also have other health issues, such as hypertension, diabetes.
The CDC says people on dialysis who contract COVID-19 often have severe adverse health outcomes. Half require hospitalization and 20% to 30% die from COVID-19. Shara Taylor, Fox 61 News.